All right. Good morning.
Morning.
So, could you just give us a quick sense of kind of what you came in before we did everything, and tell me more about how what your function was like, your pain was like, and how long you had it for?
Well, I've over the years I have found every which way to bang my knees. Worked in a business that had a lot of deadlines, and somebody would call me, and I'd jump up and whack my knee, one knee or the other, on the side of the desk or something else as I was responding. And over the years, it just got worse and worse. And one of my favorite things to do was walk our dog Bentley, and it was becoming harder and harder, and it hurt as I was walking. He'd like to run, and I used to run with him, and that got difficult. And so I said, I've got to get some, help with this, get some opinion. And your name was mentioned by quite a number of people that I know, people who are in the business. My chiropractor, Len Stein, who was with the Warriors for years, and he recommended you. Other people knew you, so I thought, well, not to mention your walking distance from my house.
Yeah, perfect.
So in any event, I came to see you, and we talked about the various possibilities for care to improve the situation. And the one that popped out and seemed to be the number one easiest thing to do. I'm 71, so I'm not really interested in invasive surgery at this point if it can be avoided.
Mm-hmm.
So we came to the conclusion stem cell, the stem cell process. And since we had the procedure, which was on July 13th, 2019, it improved almost immediately. I did the exercises that you said on the bicycle, no resistance, did that religiously for a half an hour, put on a TV show that's half an hour. When it starts, I start pedaling. When it ends, I stop. And it's been great. I don't have any pain. It's been that way now. I was surprised at how soon it kicked in. You said it'll take about 3 months, so I'm thinking September 13th, it's going to be great. But it actually kicked in a lot sooner than that. And even I've now been running across on the grass with my doggie, and we just got back from New York. We were there for a couple of weeks, and we were averaging, my wife and I, 7.5, 8 miles a day of walking. We walked across the Brooklyn Bridge into the Brooklyn Heights, all kinds of things that were fun. And I am really appreciative of what you've done.
Awesome. The if you were to kind of distill it into a kind of a percent better in terms of pain and in terms of function, what would you say?
Well, would 100% be enough? I mean, there isn't any pain.
Cool.
There isn't any pain. I really expected there would be. But, and I'm being careful. I mean, I have to say that I have made some adjustments.
Good.
There is no emergency that's going to get me to jump up and whack my leg anymore.
Yeah.
I've adjusted that. I don't want to go back to what happened before. So I don't care what it is. I get up carefully, and then I walk around and respond.
Good. So overall, happy with the procedure. You're happy you did it.
I recommended it to other people. that have complained. It's amazing the number of people out there who friends of mine who say, my legs are hurting, or we'll be walking along, they're complaining, or just they know that I've had some work done on my knees, and they'll say, "What'd you do?" And I'll talk about it, and I'll mention your name.
Appreciate it. Thank you. I appreciate it.